My name is Ahmed Hamouda. I'm a consultant surgeon at Benenden Hospital and I specialize in upper GI surgery. So the stomach normally produces a large amount of acid to help digest food, but also to get rid of any bacteria or microbes that we may ingest with our food. If the valve at the lower end of the gullet is weak, then that acid may travel up into the gullet and cause symptoms of heartburn. So acid reflux can be caused by certain medications, such as non-steroidal anti-inflammatory drugs. That could be brufen, for example, diclofenac or aspirin. It can be caused by obesity. It can be caused by stress. Pregnancy, of course, can cause an increased abdominal pressure and push acid up into the gullet. So those are some of the reasons why people may suffer with acid reflux. Essentially, people with acid reflux will suffer heartburn as a symptom. That is a burning chest pain. They can also develop bad breath or perhaps even cough and splutter. They can find that it's very difficult to bend over or lie flat because all the acid then comes up into the gullet and they have increased amounts of symptoms, and eventually it can lead to things like erosion of the back of the teeth. So once one has developed heartburn and reflux, they need to first of all come and see us. They can get a referral from the GP, but also equally they can just phone us up directly and we will then see them in a specialist clinic. We will go through their symptoms, go through all of the medical conditions that they suffer with or any medications that they're on, and try and make a diagnosis and then move on very quickly to the diagnostic stage, which includes a camera. It may include something like an acid test to measure how much acid comes up into the gullet. That's called pH manometry. Essentially, what we're trying to do is start off with medication to see whether we can control the symptoms by just medication. And the medication will probably be something like omeprazole or lansoprazole for a period of time before we then assess further whether the medication is controlling the symptoms or not. But also some lifestyle changes, which are really very, very important in this condition. So things like avoiding stressing factors, avoiding certain types of food that could cause reflux. This can include spicy food, it can include alcohol, it can include things like chocolate, for example, for some people. And if all of that doesn't work, with the help of the medication as well, and symptoms continue to be a problem, then we can go further into discussing a surgical cure for the condition, and that's an operation called fundoplication. So the fundoplication itself is an operation where the basic principle is we put stitches into the diaphragm to make it very snug around the gullet to avoid any acid from traveling up into it, but also take the floppy bit of the stomach and wrap it around the lower end of the gullet. This recreates the valve effect that has been lost previously and hopefully allows the stomach acid to stay in the stomach and not come up into the gullet. Once that operation has been done, it can be either done as day surgery or a one-night stay with keyhole surgery. Then we would check and make sure everything's all right. Obviously discharge the second day, and then keep an eye on you for a period of time, which may be anywhere between 6 weeks to 3 months. So fundoplication is a very good procedure for acid reflux. It tends to give a cure in almost 90 to 95% of cases. There is a very small chance that the acid reflux symptoms will not be completely dealt with, and that can include other factors such as a hypersensitivity of the gullet to acid, in which case even a very small amount of acid can cause symptoms. And of course we try as much as we can to make that diagnosis early on before we consider the operation. But also sometimes the wrap, the fundoplication itself, may over a period of time loosen up, and of course that's why it's very important for you to maintain contact with the hospital and with us as a team to look into any of those issues. So once the actual fundoplication has been performed, then it's really, really important to recognize that we've made the lower end of the gullet tighter. So eating patterns may need to change. Eating little and often, having small mouthfuls, being able to flush things down with a bit of water or liquid, because, of course, you may find that with very chunky food or pieces of solid meat, it just sits above that wrap and it doesn't go through as effectively as it did before. So there may be an increased sense of food sticking, and therefore there needs to be a bit of a change to our dietary patterns. Here at Benenden, we are very lucky to have the full spectrum and comprehensive service where we have physicians who deal with this the condition, but also surgeons who will look into further treatments if medication doesn't work.